All right, and as usual thing, if you cannot talk today, that's totally fine. Maybe you are driving, or you are children, or you're working. Please, can you let me know in the chat box before we start, so that we do not waste any time? So just send me a quick message, please, in the chat, and say something like, Alan cannot talk today. So Mohammed Riaz, no problem, sir. Guys, like this. Here's an example. Look at these polite people. And I'll just draw a circle here. So no Norzad today. No problem, Norzad. Anyone else? Okay. So there's a few more. Aurelia. At the moment, Aurelia, yeah? But if you can later, let me know, okay? I'll just cross you off the list as well. I've got a list here. So, okay. Everyone else, let's get started with this class. We are doing OET Listening Part A. I'm going to start the recording now, and we're going to do, hopefully, a lot of good practice. Okay, so here we go. Okay, so this is OET Listening. We're looking at Part A today. We're going to do some sort of technique practice, and then we'll do a mock test. Yesterday, you did some vocabulary. Vocabulary is very important, but today it's all about practicing. Let me just share my screen and make sure that everyone can see the right thing. Can everyone see this here?
Yes.
Yes.
Fantastic. Now, let's start with this game that I sometimes play. The game is, you tell me, is it a noun or a verb or an adjective? Okay, very quickly. If I say, for example, hat, you will say
No.
If I say which, you will say
Pronoun.
Close.
relative pronouns. Okay.
Question.
If I say something like, or it could be a question word. If I say something like get.
Verb.
Okay, what about yet? Yet.
Adverb.
Adverb. Fareed, very nice. Okay. What if I say something like, leak?
Verb.
Verb. Okay. And this is in the listening today. Today we will hear this word. What does it mean, leak? What is leak?
Leakage, drop,
Leakage, yeah.
water coming.
Water coming out, okay. And sometimes, what if I say
liquid, there'll be more.
Yeah, that's true, actually. It's not always water. Thank you, sir. So it would be liquid, okay. What about if I say this, leaking?
Gerund?
Noun.
Okay. And again, it means the same thing, water coming out. Okay, what about something like this, dusk? Dusk.
No.
Very good. Rima, what does it mean, dusk?
Not midnight.
Just Rima, guys, just Rima for this, please. Go on, Rima.
I know, but how can I explain? Night. Just night, but not
before night.
Okay, now, guys, this is important for our Zoom class today. Okay, if I say just Rima, we're on Zoom, so you should not talk over her. Then, if I say, okay, everyone, then you can talk. So, Rima, just before the sun, Rima, goes
black, dark.
Up or down? Up or down?
Down.
Everyone? Down. Okay. So that's dusk. It's a noun. Okay. Let me do one more and then we'll start this class. Unnerving. This is from the listening today. Unnerving. Anyone?
Confident.
Adjective.
Lose of confidence.
It's a gerund again.
Gerund.
But it is usually used as an adjective. Yeah. What does it mean? Khwaja, do you know what unnerving is?
Angry.
Making discomfort. Making you anxious.
Angry,
Not
Angry,
confident.
discomfort.
Anxious. Now, this is why we always have a mute, guys. So again, someone has a very noisy microphone. Keep microphones off until I say names, if it's okay. So unnerving is a gerund, ing. and it means it's making you anxious. Okay, this is just a game, guys. Today we're studying OET.
Alan, could you say about could you talk about the complaint?
What do you mean, sir?
About the different forms of complaint, like it's noun.
Yeah, we could do that next time. I'm going to start now, but you know I normally do that one. But yeah, I'll definitely do that one next time for you, ML. Now today, guys, we're studying Part A listening. We have to look at the format. There are some new people here. Then I'm going to do techniques, and we'll do some practice. And then we're going to do a practice mock test. Okay? So this is the usual thing that I do, but I think it's really important to go through these steps. Format, what does that mean? Amir, if you could say hello, or Farouk, Mohammed Yaqub. What does format mean?
Format, how this task, I mean, the listening is made like the way it collects everything together. It's a format of this.
The way it collects, Amir?
Yeah,
It looks like.
it's structured. Structured.
Structure, yeah.
The structure.
Yeah.
Alan, can you hear me?
The way it looks. Okay. Can I hear you, sir? Yes, I can hear you.
Oh, thank you.
Okay, so that's Saeed, yeah?
Yes, yeah.
Okay, now guys, we're going to look at the format of this test. But what I will do today is put you into groups, and I want you guys to answer some questions. Simple questions, okay? Can I show you the questions? Is everyone ready to see the questions?
Yes.
Yes. Yeah.
So here are the questions, okay? And this is about listening part A. What I want you to do is go into class, groups, and answer these questions together, okay? I'll give you about 3 minutes only, okay? So the rooms are opening now. Please go into the rooms and simply answer the questions, okay? So in groups, answer questions. So if you could just start to join now, please, everyone. And I'm going to share my screen into the breakout rooms. Okay, that's enough time. Can I ask you all to stop what you're doing, come back to the main room, please, and we'll go through the answers to these, and then we'll do some practice. All right, so there's some people back already, which is fantastic. And if you're watching on YouTube, then you will see now the answers to these simple questions from these fantastic students we have here, SET. Some very high level students. This will be absolutely no problem for most people in this class. Ronica, could you say hello, please?
Yes, sir. Hello, sir.
How many questions are there? How many questions in listening part A, please?
24 questions.
Is that right, guys? Is it 20 or 24?
24, yes.
24.
20 in the reading.
It's 20.
24.
24 in listening. Okay. Now, everyone together, how many audios are there?
Two.
Audios.
Two audio clips.
And Farouk, how long is each audio clip?
It takes 4 and 6 minutes.
It's approximately, say that again?
5 minutes.
Between 4 and 6 minutes, sir.
Yeah, we could say 5 or okay.
5 to 7.
Between 4 and 6, yeah. Because I have seen them be 6 minutes sometimes, and I have seen them 4 minutes. So 5 on average, between 4 to 6, whatever. Okay, number 4. How long before you start each audio? Everyone.
30 seconds.
30 seconds. Sir.
And this is important, isn't it? Because this is part of the technique that we normally use at SET and in most schools. Okay, what about Michelle? Or if we could try Emal, Rima?
Yeah.
What kind
Yes.
of questions?
Consultation.
Consultation,
What
asking
kind
the
of-
problem.
Kind of question.
You can see them here. What kind of questions are they?
Fill in the
Gap
blank
fill.
or gap fill.
Asking the question, problem, condition. Filling it.
Definitely.
In English, we can say gap fill or fill in the blank.
Filling.
Yeah, filling the
That's what we usually say. Okay, so number 6, what is the situation, everyone? The situation is
Consultation.
Consultation.
Consultation with a GP or consultation with
GP specialist.
microphones off, please. So Saeed, if you could say hello, sir. Everyone else, microphones off, please.
Hello. Yeah, it'll be 2 kinds. It's like consultation with a doctor or consultation with a specialist.
Exactly, GP or specialist. If it's specialist, then they will talk more about the history.
Yeah.
If it's the GP, then he already knows that, so they will talk more about current.
Yes, that's correct,
symptoms. Okay, so what type of list? This is more important now. So let me ask Alexi, if it's okay, Alexi, or we could try Steph or Shiromi. What type of listening are OET testing? What type?
Specific details.
Just Alexi, please, guys. If you just give him a chance.
Details.
It's detail listening. Yeah. So that's important. They're not testing you on understanding. They're testing you on your ability to grab, to get specific words that are said. Okay. You have to write down exactly what someone said. Okay, so that's 7. Number 8, what techniques should we use? I hope you had a chance to discuss this. We will discuss this now together, okay? So usually the first technique that we use, or the techniques that we use, we do them in the first 30 seconds, okay? We start to do them in the first 30 seconds. Now, I just want to show you an example of something. Is it okay if I show you an example, guys?
Yes.
Yes. Sir.
All right, so can everyone see this?
Yes. Yes.
Yeah?
Yes.
Okay, now I just want to change this slightly. So what we're going to do is we're going to do a test. Okay? Is everyone ready?
Yes.
Let's do a test. So
Yes.
I am the patient. I am the patient. And you guys are doing the test. Can I have a doctor, please? Any doctor? Hamza. Okay. So Hamza, you can say Hamza, can you say to me, Alan, how are you at the moment? Okay. So Hamza, ready? 3, 2, 1, go.
Good morning, Alan. How are you at the moment?
Hi, doctor. Yes, well, to be honest, I am feeling, I think I've got a cough, and also I think I've got a headache, and also I think maybe I've got like a sore throat, and also a rash on my shoulder. And I also I'm feeling pains in my stomach. I also experienced some anxiety at night, and I've been urinating a lot, quite frequently. And last year I was diagnosed with depression.
I'm sorry to hear that.
Yeah, very bad. It's all very, very bad. Now, what was the answer for this one, everyone? Did you get
Anxiety.
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 what was the answer for this one?
Depression.
Depression.
Now, Shah Jahan, are you here?
Yes, sir.
What was the answer for this one?
Depression. Which one, sir?
These
Cough.
three.
Cough.
Cough,
Cough.
Cough, headache.
Symptoms.
Third row.
Cough,
Headache,
headache.
Rash.
rash. How many symptoms did I say?
You four.
Mentioned up to 5.
4 or
I
5.
said
Five.
I said 4 symptoms. There's only 3. There's only 3 options, right? So I'm trying to show you something, right? When you have this, it's different, isn't it, from this? Why is it different?
Yes.
Why
No
is it?
signpost.
we have to selector words.
These are specific.
Yes.
Here you have no idea
Yeah.
what it is.
Yeah.
You've got no idea. It could be dog, cat, fish, could be Manchester, London, Paris. You have no idea what these ones might be. Here we know what it might be because we have these words, okay? So the first technique that I always teach is this, categorization, okay? You need to think about what categories of information will go into the blanks, okay? This one was much easier because you knew it's probably going to be a symptom, right? You can guess the category of information that is required. What is this one, guys? What is this one here?
Condition.
So I'm just trying to show you that this predicting of categories can be very useful. It really helps us, all right? So technique number 1 that we always teach is, predict categories. Chamika, could you say hello?
Hello, Alan.
Can you give me examples of categories that we normally see in OET? Symptoms,
Symptoms, medications, condition,
medications, what else?
actions,
Actions, what else?
body parts,
Everyone, body parts, what else?
Jobs.
Description of.
Equipment.
Treatments.
Description of.
And the most
treatment,
one would be description.
Equipment.
Okay. Description of is very important because it's not like the other ones. It's different. Okay.
right,
Description of will normally be an adjective. It will normally be an adjective, or it could be a noun. Okay. So in terms of techniques, what we're doing in this exam, in the 30 seconds before we start, we think about what category can go here. For example, everyone, prescribed.
Medicine.
Medication.
Medication.
That's easy. That's easy. Okay. Next one, unable to blank.
Symptom.
Action.
Word.
action,
Probably an action like walk or drive, right? It's going to be an action. Okay. What about reported We're given blank to help.
Equipment.
Medication or
Equipment.
Well,
Equipment.
if this is action, it could be equipment, right? Walking stick,
Equipment, yeah.
chair, something like this. What about pain is?
Body part.
Description of.
Okay, description.
It could be a description of. Okay, it's not going to be a body part. Pain is head. That doesn't make sense.
Pain is less.
It has to be an adjective.
Yeah.
Right? So pain is severe. Pain is mild.
Mild, moderate, severe.
Right? So this category is called description of. And you see this in OET very often. You know that you are listening for an adjective to describe the pain. Okay. Last one, guys. Works as
Job.
Occupation.
Job description.
job. Okay. Let me test one of you. Adnan, can you say hello?
Yeah, Alan. Hello. Good morning.
Consumes blank. Bailey.
Yeah, consumes. It's like of fluid or foods or any noun.
Yeah. So food. Let's just say diet. Okay.
Diet. Yeah.
So yeah, fluids or food. This prediction of categories is very, very useful in OET, okay? But we also have another technique, which I call signposting. Very simple, very, very simple. What is signposting? Can you put your hands up if you know what signposting is? Gula, tell me, what is a signpost, please?
When we see the sentences before the gap.
Okay, so can you give me an example? Is there an example here?
A condition maybe reported to local clinic.
This one.
Yes.
Let's try, guys. Is this a signpost? Everyone?
Yes.
Yes.
And another one is
Condition.
Condition.
Frequent
Frequent
urination.
urination.
I lost it.
condition. No, where's condition? No, it's these two. Okay. Signposts must be separate from what?
Different.
The
Commas.
A gap.
yeah.
Okay. I cannot rely on any of the words here as signposts. Okay. Gula, what is a signpost? What is it?
It helps to us. Something will come. The answer will come after this verse, maybe.
Yeah, tell me what is coming. Excellent.
Where we are.
So we use things like frequent urination or even condition, right? We use that to say, oh, this is where I am. Okay.
Yes.
We do not use the word diagnosed. And the reason is, anyone? What's the reason why I cannot use diagnosed?
Because the same line.
It maybe comes
It's
after the
not good
answer.
signposting.
For example,
It can be after the gap.
for example, okay, guys, listen to number 3. Okay, this is test again. Hamza, can you ask me a question? Okay, let's imagine that he's asked me. Ready? 3, 2, 1, go. So hi, doctor. Yes, I experienced lots of anxiety last night, and I've been going to the toilet a lot. And you know, diabetes is something that a long time ago with my other doctor, I was actually what he did is he produced something which some people call a diagnosis. What's the answer?
Diabetes.
Diabetes.
Was this near?
No.
No.
Very
No.
very far away. Okay, so we cannot rely on this as a signpost. This is a signpost. There's another technique. One more technique.
Selector words.
Selector words.
I call these selector words. Okay, and this is something that works in IELTS and it works in OET. Okay, put your hand up if you know what a selector word is. Anyone know what this is? Let me test you then. If people are slow. Maybe Ruth could say hello, or we could have Shiromi, Shamika. Could you say hello?
Hello.
Ruth, Shamika, Ruth and Shamika, Shiromi. Do you know what a selector word is?
Selector words, most probably it comes after the blank example, experience, symptoms at night. At night is a selector word, maybe.
Yeah, I mean, it can come before as well. It can be at the end, or it could be here, right? It doesn't really matter, but it is a selector word. For example, guys, listen again. Ready? Tell me what the answer is here. 3, 2, 1, go. Hi, doctor. I am having a lot of difficulties at the moment. I'm feeling quite depressed, and my stomach hurts a lot. And I'm getting sweats during the night.
Sweats.
Sweat.
Sweat.
Why not
Sweat.
stomach? Why not stomach?
At
Because sweating at
Because
night.
you said
Night.
during the night.
Mentioned at night.
Right? So I didn't say I had stomachache at night. I didn't say I was depressed at night. I only said I had sweats. Okay. So yes, you know the category, but sometimes you can get 3 examples. And that's when selector words will help you. Okay. So I know you do this automatically when you're doing the test, but think about it. This is the systematic way to do this test. All right. So selector words are words that help me choose when I hear 2 answers. Okay. Does this happen in OET, everyone? Do we get this problem?
Yes.
Absolutely, many times, right? They might talk about their hobbies, and there's 3 hobbies, but you only have 1 gap, right? How do we know? Selector words. Okay, if I say on a horse, right? That would be my selector word if there is more than one hobby. Okay. Can we do a test? Can we do a test with this?
Yes.
Yes.
This one here, ready? This one. Okay, now pay attention. Okay. Write down 1, 2, 3, 4, 5, 6, 7, 8. Okay. 3, 2, 1, go. Hi, doctor. Thanks for seeing me today. I've been having loads of problems. I've got a cough, which happens at night. Actually, no, it doesn't happen at night. I have anxiety at night. The cough is during the day. I'm also going to the toilet a lot, which is really stressing me out. I've been diagnosed with depression recently, so I was prescribed antidepressants, and that's meant that I'm unable to drive to work because it makes me a little bit drowsy, some of the medication. I've reported this to the local clinic, and they actually gave me they gave me a number of things. They gave me some advice, and they also gave me some leaflets to get some help for my depression. But they also gave me a bicycle so I can cycle to work, and that really helps me. As well as that, I've been experiencing a lot of pain. The pain is quite mild. I actually work as an IT professional, so that's not really a problem during the day. And to be honest, I try to eat a carbohydrate low diet every day, but I don't really do that, to be honest. I actually eat a very fatty diet daily. I've got a number of hobbies. I love to play basketball, and I love to play football, and I love I love going for rides on my horse. Okay, what was the answer for number 1?
Anxiety.
Because I changed it, right?
Yes.
Yes.
Okay.
Cough during the day.
Did I say urination here?
No, going to toilet.
Going to toilet.
Let's go into toilet.
Frequently.
Diagnosed with
Depression.
depression. Okay. Prescribed
Antidepressant.
Depression.
unable to
Drive.
More.
Drive.
Drive.
Drive. Okay. Now there was many things. I was given many things, right? Advice.
Bicycle.
Is it advice?
No, bicycle.
No, bicycle.
Leaflet.
I said three things. Okay, but
Yeah, leaflet, bikes, advice.
Advice and advice.
when I said bicycle, I said to help.
Yes.
Leaflet also.
Yes, it is.
Okay.
Advice can also help, sir.
No, bicycle was the answer.
But you got to listen to the selector word, okay? So what word did I say this in connection to? Okay, pain was described as what?
Mild.
Mild.
Quite mild.
Quite mild.
Night.
Mild.
IT.
Mild. IT professional.
IT professional.
And now the diet, I changed this one. What's the answer for this?
Low carb.
Fatty diet.
Oh no, yeah, that's true.
Because what I did is I changed my answer. Okay.
Yeah.
So again,
Fatty diet.
and when I changed it, I said daily.
Yes.
Just to help you. Okay, hobbies on a horse, easy is
Right.
Basketball.
No, riding.
Yeah.
Okay.
Basket.
Now, guys, thank you. Sorry, this is great. This is just we're just practicing. Okay. Do you guys feel ready for a full test?
Yes.
Yes.
We're going to do the same thing, exactly the same techniques, but we will have a full test. And it's not going to be like me talking. It will be audio. Okay. Now, the name of the guy is Dominic D'Souza. Maybe you've seen this before, but we haven't done this in the school for a long time. How much time do we have before the audio starts, everyone?
30 seconds.
30 seconds.
So normally in 30 seconds, can I do all of these?
No.
Oh, probably just 4.
5 or 6.
4 or 6.
Okay, so let's just focus on these, and then when the audio starts, we can continue to read. Okay. So Dominic D'Souza, here I have a signpost. My first signpost is right. This tells me question 13 is coming. What is the category for question 13, guys? Symptoms first apparently.
Describe.
What is it? A symptom?
Conditions.
Conditions.
Description.
Symptoms for what is his condition? Is he got eye?
Poor vision, maybe, or
Now look at this guy, ophthalmologist.
yeah.
So this is a strange one. This is an unusual one, right? Maybe
Situation.
It may be like a sense. Yeah, probably like seeing, something like that. Okay. Yeah. Now this is a tricky one. They're not always so clear, but I would say sense. Sense like hearing, speaking, listening. 14. He has recently stopped working as a
Job description.
That one is nice and easy, isn't it? That one is nice and easy. Where is my signpost for 14?
Repetition.
Now, Saeed, who will ask me about this optician?
Optician consultation.
Probably the ophthalmologist will ask this.
Ophthalmologist, yeah.
Ophthalmologist will probably ask. Anyway, this is a signpost. Okay. Possible blank observed in left eye. Everyone, possible blank.
Description of symptoms.
Increased intake of
Maybe food or medication.
Diet.
Okay. Maybe 17 as well. Blank suspected.
Condition.
And remember, we have lots of good signposts today. We have this one is a good signpost for 16. Okay. Now, what about selector words? Does anyone see any words that can help me?
Cause of concern, sir.
Left eye.
Left.
No,
No, this
really, no.
No.
Cause of
Administered.
So spectate.
Ah, sorry, yes, lecture. Yeah. Okay, microphone's off. Someone's got a very noisy microphone. Come on, microphone's off, please. Some noise now. I would say that this is a good one, right? He might say first and second. You want the first one, right? That's a good selector word. I think probably intake and recommend exactly Najibullah. He might talk about 2 foods, but only one of them is recommended, for example, right? Lastly, condition, maybe cause for concern. Maybe this is my selector word here, okay? So look, these techniques, I'm not saying that you do them immediately, you can do this really quickly, but you're studying OET. We have lots of videos on this on the website. This is good technical OET listening techniques. Is everyone ready to start? Is everyone ready?
Yes.
Yes.
Now, what do I do when the audio starts and we get to 18, 19, 20, 21? What do we do?
Continue to predict.
Predict.
Continue, right? Continue thinking about categories, predicting. Think about signposts. Think about selectors. It's just a way of thinking, okay? So I'm going to start the audio now. If